Hello, this is Sherman Blackwell, and welcome to this week's program presented by Singing River Mental Health. Thank you for joining me today. Today, I would like to continue to talk a little bit about the issues surrounding the funding dilemma for community mental health centers across the state of Mississippi. As you may know, there has been by some estimates, as much as a $20 million shortfall regarding Medicaid match money for community mental health centers, or that is actually for individuals that are served through community mental health centers. And this dilemma, as many people met this past Friday, which was July 10th, at the Capitol in order to attempt to get the governor to look for help with the $7 million shortfall that is immediately needed. And we still are in the process of that. And so today I wanted to talk to you a little bit about that and give you some information that you may have already seen in the paper, but also to underscore the importance of these services continuing to be provided to what I believe are the most in need in our state. And this, of course, covers all 15 community mental health centers across the state of Mississippi. There are approximately 100,000 individuals that are served through community mental health in the state of Mississippi. And a shortfall in the match money for some regions would drastically cut their services and cut them pretty quickly. The way that breaks down is, of the 15 community mental health centers, 5 do good, 5 do okay, and 5 don't do well at all. Fortunately, Region 14, where we are in the top of that because of the great staff that we have and the people that care about the individuals that are served here. And it has a lot to do with the way things are managed according to the paper and according to some opinions across the state. There are differing opinions, of course, regarding that. And I know that there are a lot of other issues that are facing not only our state but our nation, one of them being unemployment, which has now reached a high of like 9.5% for the numbers ending when the last of June, when they came out with some 460,000 other jobs being lost. And of course, funding is critical to anything that we do. And when we talk about Medicaid match money, we're not talking about specific, we're talking about the individual that is being served and how the state of Mississippi handles the Medicaid entitlement money. Mississippi is a state that gets one of the a good deal from the feds in that for every dollar that they spend, the federal Medicaid entitlement program gives them $3. And so there's a lot of things that are running together, and how this dilemma all evolved. It's actually been an ongoing thing from year to year, every year. Community mental health centers do not get fully funded like other state agencies. We don't get fully funded. Basically, according to Jerry Mayo, who is the president of the Community Mental Health Center Association, about 83 cents on the dollar. And so that's a big chunk of the funding that needs to be addressed and taken care of. And the reason that I bring this to you today is because there is a possibility down the road, if this money is not met, that there will certainly be a scaling back of services provided through every community mental health center. Through everyone will have to find a somewhere to scale back. And fortunately, we have been in good shape so far. Let me take some excerpts from the meeting and the dialogue that took place. This is from the Clarion Ledger, and the headline, Sheriffs Mentally Ill Need Centers. And here's a quote talking about the 15 community mental health centers around the state that serve near 100,000 individuals. Holmes County Sheriff Willie March, president of the Mississippi Sheriff's Association, said he and other sheriffs expect to see more mentally ill persons wind up in their jails if the funding doesn't take place, the complete funding. At issue here is the governor vetoed taking $7 million out of the state's rainy day fund and to use it for Medicaid match money to community mental health centers that the Department of Mental Health already had been forced to pay. His press secretary, that is Dan Turner, said Barber has no plans to change his mind. That nearly $30 million shortfall means centers will have to get rid of some programs. This is in the Clarion Ledger. This is July 10th. Get rid of some programs and some of their 3,700 employees. That's collectively across the state. Mental health center officials say. And so many went this past Friday to attempt to meet with lawmakers directly. Some employees went. A lot of people went to meet. And it is important. We think that all of our services here in Region 14, that is in Jackson and in George County, we are fortunate to have as many programs ongoing as we have, and to be able to continue those programs has been a blessing, if you will, from everything from our adult program, our children's program, our substance abuse program, along with our intellectually disabled program are moving forward at this particular point in time. We are one of the few areas in the state that still offers this panacea of services, where so many others have, before this dilemma came along, had already begun to cut back their services throughout the state. And some of them allow certain services to go to regional centers, whereas we have been robust and aggressive in continuing to serve as many individuals as we can. And let me take this minute to see the number you see there on your screen. That number is available to you 24 hours a day, 7 days a week. One of the primary reasons that we bring programs like this and use other media outlets is to let the community know that Singing River Services is here and is available to you. The issue always with mental health and those related subjects are, it's not really something you want to talk about until you need it, or until a loved one needs it, or until someone you care about needs it, or a friend, or something happens at work and on a job. And we are fortunate on the coast because our economy seems to be doing pretty good. I know the 3 coastal counties account for like 16% of the gross product for the state of Mississippi. Because of the industry that we have here, the leadership that we have here, and just the good people that want to work and do that. However, if you ask every other person, they will tell you that there has been a slowdown in what they have been doing, whether that's in their business, some still in jeopardy of losing their employment. This, of course, has a residual effect. It certainly does. It comes down. It affects families. It affects relationships, husband and wives, partners. It reflects how people deal with their lifestyle and what they have to make adjustment. People have adjustment issues and those kinds of things that are coming. Because it all comes down to here, obviously. We've talked about the big picture and all the things that are happening in Washington or around the world, and then it ultimately ends up on your street, on your block, and there is where we have to live with the issues, deal with the issues day to day. And so that's why I'm talking today about the funding. I think it would be easily taken care of. I'm certainly no politician, don't know anything about the particular ins and outs of how that works, but I know that many people, many parents, many advocates for people that are most in need in our area deserve to continue to go forward. Is the overall system probably being taken advantage of? Sure, it is. But when it comes to people with serious mental illness, we cannot afford to have any cuts in that regard. We can't have any, and people say, well, you ought to privatize it. When things happen, when everyone knows when things go private, that only those that can pay get served, and many times those that can't don't. And that is one of the things about Singing River Mental Health, is that we take people regardless of their ability to pay. And we believe passionately in helping as many individuals as we can. And so we're asking you today, if you care, if you're interested in, if you have a family member, know of someone, have a friend that suffers with a mental illness and doesn't have any way to pay for the services that they get, then the issues at hand stand to make it a little worse than it is now. I'm not an alarmist. I don't like to talk about these kinds of things. Rarely do I. But today I feel the need to. And we're going to take a break right now. We're going to come back and look at the rest of this article and talk about some other things that we've got coming up at Singing River. Hello, this is Sherman Blackwell. Welcome back to the second half of today's program. Thank you for joining me. As we talked in the first half of the program, we're talking about the issues that are at hand regarding funding and services and the possibility of having some services cut across the state of Mississippi. This is something that is very tangible and very real that's happening in our state capital. Many people from community mental health centers, employees, and people being served out of those centers met last Friday and met and talked to people at the Capitol about the issue that is at hand, that issue being finding additional funding for community mental health centers that would ensure that the now 100,000 plus people that are being served in community mental health centers across the state of Mississippi will continue to get those same services. And right before the break, I mentioned too, I'd rather have someone on here talking about, and we've got a couple of things that we're going to talk about coming up. One of those being with Dr. Mark Yeager and our camp for autism spectrum that's going to be coming up in the fall, and we're excited about that and looking forward to that. But I'd rather be talking about the kinds of things that offer and in the community that we have and can offer there, as opposed to getting you to talk to someone in the legislature. I know we say, well, it's done, well, there's special session. There's still opportunity. Talk to the governor's office, talk to the lieutenant governor's office, not for community mental health centers per se, but for the individuals that are served in those community mental health centers. Let me continue to read this, some excerpts from the article. This was from Jay Mitchell in the Clarion Ledger. His date is July the 10th, and we talked about some of those centers. Jerry Mayo, president of Community Mental Health Center Association, praised the House members for their support, but said others have placed politics above the needs of the seriously mentally ill, developmentally disabled children, and the elderly. He goes on to state community mental health centers which operate independently and are not state-owned serve more than 100,000 Mississippians a year, including those who suffer from mental illness and addiction. These are some of the most poorly funded programs in the state, he said, and ironically, they are also some of the most needed, and of course they are whenever you're talking about dealing with community, with mentally ill individuals in our community, and giving them an opportunity to focus on life to the ability to which they are and can, and live as autonomously as they can. That's something that we want to continue to project. So Turner said the budget for mental health has been reduced 2%. If the department wanted to, he said they could, that is the Department of Mental Health could fully fund community mental health centers. They could do that. Ed LeGrand, who is the director of the Department of Mental Health, is quoted as saying that his department actually has seen a cut of 6% instead of 2%. So it's already affecting the Department of Mental Health. The department could allocate enough money to cover the center's Medicaid match, he said, but it would mean diverting $24 million from other operations requiring significant cuts, such as laying off 500 employees, discontinuing the services that they provide, and closing all 7 crisis intervention centers, which is not something that we advocate or want. We need more crisis intervention centers. We need more. We need one here locally in Jackson County. And I know that there are people that are working now to try to make that happen and have been working for a number of years to make that happen. So it's very, very, very important that we have community leaders who understand, like the Sheriff's Association, like they do, and like anybody who is interested in helping individuals with a mental illness. The Lieutenant Governor, Phil Bryant, said in a statement, "I certainly understand the importance of community mental health facilities throughout Mississippi. We are independently verifying the numbers, assessing the situation. Just as the case of any other business, good management is essential for community mental health centers to continue carrying out their responsibility and to receive state funds." So we certainly appreciate that. Dave Vann, who's a friend of mine, who's been on this program, who is the director at Region 8, he said some centers haven't had Medicaid match money paid in 3 years. To give you the disparity of what the situation looks like, and the services that were not being delivered. Of the 15 centers, Van says 5 are doing well, 5 are doing okay, and 5 are not doing well. Mayo, the executive director at Pine Belt in Hattiesburg, Jerry took a little bit different stance and disagreed that the centers could not survive without the Medicaid match. The rest of state-funded agencies are reimbursed at 100%. Mayo goes on to say, I don't think that any center could survive on 83 cents on the dollar. He said you might make it a year or two, but long term it's not viable. So these are the issues, and sometimes, like with anything, I know and I may not be articulating it as clearly as I need to, and a lot of times things in government, in law, is not always real clear, but fundamentally what is at issue is what has always taken place previously throughout the state of Mississippi, and that is a Medicaid match for the community mental health centers in order that they would not have to reduce their services because a larger percentage of our reimbursement is with Medicaid, because the individuals that we serve are Medicaid recipients, and it is a federal program doled through the states, targeting those that are the most in need in our community. And when we don't take care of the most in need in our community, then it has a way of creating a lot of difficulty for others in the community. So bottom line, I'm asking you to contact, if you're interested, if you care. It is about services continuing to be provided at the same level, at a minimum, to nearly 100,000 individuals across our state. And you can do that by contacting the governor's office, the lieutenant governor's office, making it known to your local representative or senator. They need to know. They certainly need to know. We've got a couple of things coming up. We're closing out at this time in next week, or this week and next week, our Children's Day Treatment Program. That's been ongoing for a total of about 8 weeks now, where we've had a successful campaign. It's continuing to serve scores of individuals, children in particular, that have seriously emotionally disturbed issues. We have that coming up in August 12th, 13th, and 14th. There will be an Alzheimer's conference. I have the privilege of sitting on their advisory board for the Department of Mental Health, and Kathy Van Cleve does an excellent job, and her staff there. This was one of the largest attended conferences in nearly 800 people last year in Philadelphia, Mississippi, and we're going to be there again this year. That's going to be August 12th, 13th, and 14th. That's a Wednesday through a Friday. If you know of someone, or you have a family member or a friend that suffers from some type of dementia, I would invite you to call the number, get some information about the conference. It is a conference that is really a conference where you have a lot of individuals, laity for lack of a better word, people who are interested, who have a parent that is, or a loved one that is suffering with some stripe of dementia, and have a lot of good information, opportunity to talk to professionals, get information, get help, get educated on it. There are some good things that are happening in that field, and we would invite you to join us for that. And you can call the number you see on the screen there, and be glad to get you that information about when the conference is going to be. And that's going to happen, as I mentioned, in August the 12th, the 13th, and the 14th. If you have any inquiries about something that has been said on today's program, or something that's been said on a previous program, please be sure to give us a call. I want you to know that Singing River is here for you, and we want to be a resource person, agency for you. We want to get you information We would like to get you all kinds of information regarding everything from depression signs, things to look for, help, where to get help, other community agencies that do a wonderful job assisting people. We certainly can't do it all, don't do it all, but we do our fair share and maybe a little more. But we'll be glad to get you that information and to educate individuals that will be glad to come to your place of business, to your workplace. We have employee assistance programs, start up to come talk to you and talk to your business and talk to your people. Because when you have productive workers, you obviously have more productive business. And we come into schools, we do health fairs, we do those kinds of things. We've got National Depression Screening Day coming up in a month or two, and we'll be talking about that. And we're just trying to raise awareness about the information that is available to you through Singing River. This is Sherman Blackwell. I certainly appreciate you tuning in today, and we're going to look forward to seeing you again next week.